We have seen an increase in whooping cough in the last few years. There are a variety of reasons for this. One of them is we have more effective testing methods to detect it. Another is we're recognizing that whooping cough causes a prolonged cough illness in adults. And a third is that the vaccine, while being the most effective way to prevent whooping cough, may not be quite as effective as we had previously hoped. The other problem is many people are not vaccinated. Only 13% of adults who are recommended to have a booster that includes the pertussis or whooping cough vaccine have had that vaccine. And so people are also not vaccinated the way they should be. So we would recommend anyone who has any contact with infants or young children receive a booster that contains the whooping cough vaccine.